on to our author highlights. We're very excited to share our paper focusing on using deep learning-based approaches to predict the risk of major adverse cardiovascular events after liver transplantation. This paper has been already accepted by the Mayo Clinical Proceedings Digital Health, and please look out for its publication in the June 2024 issue. We thank our co-authors for their invaluable contributions to this research. In addition, we would like to acknowledge the grant support from the American Heart Association and the National Institute of Health. My name is Cui Tao. I am from the Department of AI and Informatics, Mayo Clinic. I am co-presenting this paper with my colleagues, Dr. Ahmed Abhamid, a research fellow from the Department of AI and Informatics, Mayo Clinic, and Dr. Liu Yan, the Division Chair of Hepatology and Liver Transplant from Mayo Clinic, Florida.
Liver transplant is vital for those battling acute or chronic liver failure. With over 10,000 liver transplants in the United States in 2023, we are seeing more transplants in older patients and those with comorbidities, heightening the risk of coronary disease, particularly due to the surge in fatty liver disease. A significant hurdle has been the inadequacy of non-invasive stress tests in detecting coronary disease in cirrhotic patients.
AI holds an important role in healthcare, promising to revolutionize many aspects from preventive medicine to chronic disease management. AI's predictive models, for example, can personalize treatment plans, tailoring interventions according to the individual's health history. In this paper, we aim to leverage the latest advances in computational power and the wealth of healthcare data available. We focus on developing and validating the predictive power of machine learning algorithms, with a special emphasis on deep learning models to identify patients at risk of major adverse cardiovascular events after liver transplantation.
Our study stands out by examining a comprehensive set of clinical risk factors not collectively analyzed in prior research. Several models have been developed to predict the risk of receiving the initial diagnosis of any of the 6 post-transplantation major adverse cardiovascular events, MACE, as an outcome. By utilizing pre-transplant data to predict post-liver transplant MACE, our analysis encompasses a cohort of over 20,000 patients, including more than 6,000 documented MACE cases. To predict post-transplantation MACE risk, we examined patient demographics, diagnosis, medications, and procedural data dating back 3 years prior to the liver transplantation procedure. Our prediction model encompasses the anticipation of MACE or no MACE occurring up to 5 years post-liver transplantation, with prediction intervals spanning 30 days, 1 year, 3 years, and 5 years. In our study design, to leverage the power of deep learning sequence models and capture clinically relevant scenarios, we aggregated the occurrence of various medical concepts such as diagnosis, medications, and procedures over specified time intervals, for example, 15 days, 1 month, or 3 months, within a 3-year observation window before the liver transplantation index date. The study diagram delineates the index date, denoted as day 0, serving as a starting point for the prediction intervals. In our study, the prediction of MACE was modeled using various prediction window sizes, all starting from the index date. Utilizing a sequence of feature vectors computed every 15 days, the bidirectional gated recurrent units BiGRU deep learning model outperformed baseline machine learning algorithms such as logistic regression, random forest, and light gradient boosting machine across all 4 testing scenarios. Notably, in the 0 to 30-day testing scenario, the BiGRE model achieved the highest area under the receiver operating characteristic curve value of 0.841. Furthermore, it attained an area under the precision record curve of 0.578. This metric underscores the model efficacy, particularly in predicting the occurrence of major adverse cardiovascular events within the initial 30 days post-liver transplantation when compared to longer prediction intervals.
Our research offers a groundbreaking solution, a deep learning AI model that predicts major cardiac events in liver transplant recipients, utilizing extensive insurance data for its development. This model has shown remarkable efficacy in pinpointing the high-risk patients for cardiac complications post-transplant. Looking ahead, we plan to incorporate this AI model into our medical record system for real-time monitoring and prediction of cardiac complications. This integration promises to arm clinicians with an advanced tool to customize intervention and elevate patient care, significantly improving the safety and efficacy of liver transplants.